Is again a question concerning Dr. Zamboni's research in the warming of the hands and feet that took place after people had their collapsed veins reopened. And then the second part of that question again was, is there perhaps outside of MS just the possibility that CCSVI could help people with warmer extremity circulation? Dr. Murray.
Yes, and the observation about this feeling in the hands and feet was mostly on the internet by some people who had the procedure and were on the internet talking about this. The question of coldness in the hands and feet that occurs in MS patients, it's referred to as Raynaud's phenomenon. And Raynaud's phenomenon is actually very common. If you go around a room of people and shake everybody's hand, you'll notice that some people have cold hands. And if you ask them, they'll tell you they probably also have cold feet, and also most of the people in their families probably have, because there is a genetic relationship. So the phenomenon of Raynaud's phenomenon is extremely common. In MS, it's actually increased, and part of it is related to the less use of muscles. If you use your muscles extensively, your limbs, hands, feet warm up. You'll notice that many people, if they sit in a wheelchair with their feet down, not using the muscles, that their feet get cold, may even appear to turn blue or even purple. And that's Raynaud's phenomenon. And if you touch the skin, it feels cold. Now, people often get very concerned about it, but it's actually just an annoyance. It doesn't actually, there are vascular diseases that are important, but Raynaud's phenomenon tends to be mostly an annoyance. I suspect that the phenomenon that some of the people have reported after having veins done and Raynaud's phenomenon, I'm not sure whether it's related or not, but Raynaud's is extremely common.
Is there a connection between cold hands, going back to the second part of your question, cold hands and cold feet and blocked veins? Do we know that?
No. In fact, if you study, what you find is that it's an exaggeration of a normal reaction. If you go out in the cold, the vessels in your hands tend to constrict. If you go into a warm area, they tend to dilate. People with Raynaud's phenomenon get an exaggeration of that. So they're often individuals who, when they go out in the winter, they always put their gloves on because their hands get so cold. Whereas many other people, they don't mind, they don't put gloves on because they don't have Raynaud's phenomenon. I guess the other question is, if you have cold hands, do you have a warm heart?
Yes, indeed.
Karen, what's your experience?
Another research question for us.
Yes, to that question. I just wanted to mention that when I've had MS flare-ups in the past and I have numb hands and numb feet, I feel that they're cold and they're actually not. Yeah. I have my husband, is my feet cold? Are my hands cold? And I feel that they're cold from the inside, but they're not actually cold.
That's a good observation.
Exactly, it's very weird.
And that's another phenomenon. That's related to the change in sensation.
Yeah.
It feels like it's cold.
Exactly.
All right, we have a question coming to us from Laurie. How will you respond to pressure from the pharmaceutical industry, which may not want current drug therapies to be replaced with CCSVI therapy due to the financial impact they're bound to feel? They carry a lot of weight, pharmaceutical companies, and can slow down or even stall progress that negatively impacts them financially. I think, Eve, you were talking about this before. This is going down our highway.
Well, I think it's important, actually, to put in context the work of the pharmaceutical industry in terms of developing therapies and other actors in the research arena. Health charities like the MS Society, governments, the federal government is a very major contributor of dollars to health research through the Canadian Institutes of Health Research, and institutions, teaching hospitals and universities do a lot of science with funding that is not linked to the pharmaceutical industry. In fact, when you think of the MS Society, less than 2% of our revenues in any year comes from the pharmaceutical industry, and none of that is intended for a research program. No representative of the pharmaceutical industry has any say in any aspect of the MS Society's business. We have a policy that is very clear that when we accept their funding, it has to be without restriction. They cannot seek through their funding to control what we say, for instance. It's very, very critical. The bulk of our funding comes from individuals. About 1 million Canadians from coast to coast contribute of their hard-earned dollars through the walks and carnation sales and through the mail. And I say thank you to all of you. A small number of very generous corporations that are not in the pharmaceutical industry, Rona, Royal Bank, A&W are among very important corporate partners of the society. So at the end of the day, I hope I can dispel the linkage there and tell you personally, for our members, 30,000 people who are members of the society, who are eventually making the ultimate decisions of electing my bosses, the volunteers who sit on the board of directors, everyone at the MS side is very clear that the day there is a cure and there is no requirement for treatment will be a great day. It will be the end of MS, and we'll celebrate that. It'd be a great honor for me to put the lock on the door, I tell you. And I just want to dispel this notion that pharmas have some particular lever to control that destiny.
Okay. Is that more of an American? I mean, I know you can't speak on behalf of American healthcare system, but that may be where we get the impression from that.
No, I think, in fact, if I may, what I've said holds true, and I'll just say another piece. The MS Society has a very clear and forceful position that our federal government should almost double its level of investments of public tax dollars in health research. We spend as taxpayers through the federal government about $1 billion a year. The MS Society wants that to be $1.8 billion. And by the way, we're not alone. That's the position of a coalition of health charities, the Cancer Societies and Heart and Stroke. In the US, the level of public funding for health research, the stuff that is done in institutions, universities and hospitals, that is not linked to a commercial agenda, is actually much higher than it is in Canada, proportionately to the size of our economies, the size of our governments. So while the federal government plays a very important, critical role, it needs to play an even greater role in the area of what I would call public benefit research, the kind of work that is not commercially tied, health charities, granting foundations, Bill and Melinda Gates, or the National Institutes of Health, which is the federal government arm for health research in the US. They're very, very important institutions that fund the kind of research that is not linked to the pharma industry. It's not to say that the work of the pharma industry is not important. I want to be clear, but it is a part of the whole and very complex approach, and they certainly don't control the other parts.
Right, we have another question to us coming from Don in Alberta. Does the MS Society support having testing, MRI and ultrasound testing, done by Provincial Health Care Systems?
Thank you, Dawn, for the question. It's a very important one. The MS Society plays a very important role in advocating for therapies to be delivered quickly by our health system, our provincial health system. But it's important to understand that our health system in Canada is founded on the notion that there needs to be evidence about the efficacy of a treatment before it's going to be funded. And we have been very active players with available evidence, as in the case of the therapies that are available in MS treatments, to advocate for quickly making those available to Canadians. At the moment, if we knock at the door of governments, provincial or federal governments, we're going to be met with a response that we would expect, which is show us the evidence. So I think it's appropriate to keep elected officials informed, to share the excitement, but it's important to know that they will look to the evidence before it is funded through our tax dollars.